Hi, this is the Chapter 18 lecture. So let's get started. Really big chapter, covers a whole lot from prenatal nutrition to breastfeeding, hugely important topics. We'll try to highlight the major points that you should remember, but as always, be sure to read the chapters carefully. Good nutrition should begin ideally before a pregnancy for the reasons that you see here: to fill the nutrient stores, grow a healthy placenta, establish good habits, and a healthy weight. Unfortunately, because overall in this country, we're not eating very healthy diets, this doesn't happen most of the time. But it's another reason we want to educate children and teenagers and young adults about healthy eating and how that correlates to their health. I'll let you look at this. It's probably no surprise that a healthy diet with anti-inflammatory characteristics might increase fertility. But certainly there are individuals that struggle with conceiving, so this may be something, it's research based, that your patients, your family, your friends would want to read and look into. All right, so prenatal growth and development. We have cells become an embryo, become a fetus. We have nutrition and oxygen and other gases delivered through this placenta that is developed very early in a pregnancy. And that is one of the reasons, not the only one, that this first trimester is such a critical time in development. Quality is much more important than quantity. We'll see there are no additional caloric needs that are required, but certainly a healthy and safe diet is very important. Now, I did want to point out something that is very crucial, and that is calorie needs don't go up in the first trimester. Nutrient needs may or do, so you need to eat a nutrient dense diet, but you don't need more calories. Okay, what is a big concern is that the diet is safe and harmful or toxic components of that diet are avoided. Okay, so we know that there is development of these critical systems that can become impacted by toxic agents. Okay, in the second trimester, the fetus weighs about an ounce. It looks more like an infant. We still have the concerns about exposures to toxin. The mother is beginning to prepare, or her body to prepare, for lactation as well. And nutritional deficiencies at this time could impact the mother's ability to breastfeed. And in the third trimester, there is rapid growth. The fetus doubles in length, the weight increases 3 to 4 times. And what's really interesting about nutrition is that during this last trimester, there's a transfer of fat, calcium, and iron to the fetus. So we'll talk more about how that impacts the needs for those nutrients. So we define a successful pregnancy as keeping both mother and baby healthy. Okay, and for the mother, that involves both her physical and her emotional health. But certainly for the baby, we want gestation to be adequate enough so that the baby's systems are developed, such as the lungs. The longer the gestation, the less the health risks. And we would like the baby to weigh more than 5.5 pounds, and that is because above that weight, you see lower health risks. So all of this comes together to underscore the importance of prenatal care and counseling. You can go to the Community Health Explorer, and under, I think it falls under prenatal and infant health, you can see in the different areas of Philadelphia the rates for very late or no prenatal care, and they're high. And this is a problem because of everything we've talked about and we'll talk about still. It's important that all pregnant clients get the care that they need when they need it. We talked a little bit about this already, right? So exposure to toxic chemicals is a problem, and that can include recreational drugs, that can include some vitamins at very high levels, and it can include some herbal therapies and medications as well. So it is so very important that pregnant patients are advised as far as what they can take safely and what they should avoid. Along that same theme, there is a type of food-borne illness called listeria, which can contribute to a spontaneous abortion. So we're very, very careful and give some important advice to pregnant women, and that is they should consume only pasteurized milk. They should avoid uncooked or meats, fish, and poultry that are not thoroughly cooked. And most doctors think that when those foods are cooked, they should be reheated just to be very certain that you destroy this pathogen. A lot of little tidbits to this unit, but this is an important tidbit, and that is there is a safety net program called the WIC program, Supplemental Nutrition Program for Women, Infants, and Children, that does a very nice job of providing vouchers as well as nutrition education referrals as needed to women who are pregnant, their children, other caretakers of those children, supports clients who are breastfeeding as well, either with very nice breast pumps, or it also provides formula for those women who do not breastfeed. So this is an amazing program. And the important thing to keep in mind is that many individuals who are students, who are working at lower wages qualify for this program. So make referrals, find out more about where you refer out in your area, and be sure to spread the word about WIC. Many years ago, there was a study shown that every dollar spent through the WIC program actually saved $3 in the first year alone. And that's because the mothers and their babies were healthier when they received the nutrition they need. Okay, important stuff here. First trimester, you need a balanced diet, no extra calories. Second and third, it goes from 350 in the second to about 450 in the third. Okay, so it is an increase, but that's not a big increase. And it's really important to understand that people who tell pregnant patients to double up, you're eating for two, that's very misguided advice. Okay, that's very poor advice. 350 to 450 calories is about a very small snack, and that's on top of a very healthy diet. Okay, exercise is recommended. It tends to shorten the time of labor and delivery and help that mother stay healthy and return to return to shape quickly after she delivers the baby. So this is important. Of course, there are some cautions. You just have to make sure not to overdo it. So it's recommended that pregnant women perform at least 30 minutes per day of moderate intensity physical activity, but take care of their fluid and nutritional needs. Watch out for becoming overheated, and also, of course, watch out for any activities that could possibly impair circulation or impact the fetus in some way. Okay, so here's the optimal weight gain, 2 to 4 pounds of weight total during the first trimester. Okay, so if you have a patient who's gaining 15 pounds during the first trimester, you need to make sure they talk to a nutritionist, talk to their doctor, because that's excessive. 0.8 to 1 pounds weekly during the second and third trimester. For a total weight gain, if you start at a healthy BMI, or what's considered a healthy BMI, of 25 to 35 pounds, more if you're carrying twins. And it is important because some women are so upset about weight gain that they understand that when you gain a healthy amount of weight, or the recommended amount, you're only laying down 4 to 8 pounds of fat stores, and that's to prepare for breastfeeding. And if the woman does not breastfeed, 4 to 8 pounds is not so such a huge hurdle, such a great loss. It's when women overgain, 30 pounds over the recommendation, 20 pounds the first trimester, that then they get into more difficulty with losing that weight later. And we're not concerned about aesthetics, about size. We're concerned about health, because that extra weight sets them up for more health problems. Know these numbers for the test. So you can see here, all pregnant women are expected to gain weight, but women who have the highest BMIs don't need to gain as much. Okay, so as far as the nutrients, for protein, an additional 25 grams per day is required, but this is on top of pre-pregnancy needs. And most Americans are way above their protein needs, so they may not have to add any protein to the diet. Adequate carbohydrate, okay, you want to prevent ketosis, so the minimum is 175 grams per day. Adequate water, okay, this increases a bit more when breastfeeding. And there you see the bumps for pregnancy, red, the breastfeeding, yellow. There is more attention because of newer research that shows how important the essential fatty acids are for brain and eye development of the fetus. So we know now it's important to stress those healthy fats. Fish is a great way to consume the omega-3s that are important for those functions. You do have to be careful and make sure you're not consuming the high mercury fishes, however, because that can have a negative impact on the fetus. But there are plenty of fish, salmon being one of them, that have lower amounts of mercury and provide nice amounts of the omega-3s. So we can see when we look at these vitamins that a lot of them bump way up in pregnancy and breastfeeding. You'll see that they're listed here. Take a read about their importance. So folate, vitamin D, vitamin A, the need increases much less. Folate, however, a lot. It's important in prevention of neural tube defects, for the synthesis of DNA, for fetal growth, red blood cell formation. Minerals are listed here. Now, once again, pregnancy is in the red, so we see big bumps up for zinc. We see a big bump up for iron and iodine as well. Something to keep in mind, when you don't see a bump, that means that the need didn't increase beyond pre-pregnancy needs, but a lot of people are missing micronutrients pre-pregnancy. So this means an adequate intake is still necessary. Okay. Because of all of this, it's very common that doctors recommend a prenatal vitamin and mineral supplement, and there's not much of a downside. Some women complain of constipation, but that's more of an issue when they're given higher doses of iron. So When you take a prenatal supplement, it has been formulated so that it is safe for a pregnancy, and it is giving you the nutrients that you need in increased amounts during that pregnancy. My caution would be you would not want to take that on top of perhaps other supplements and a lot of fortified foods, because then we'd have to worry about reaching those ULs. Okay, so first trimester, no need for more calories, but you need a healthy diet. Second trimester, you can remember that 350 to 450, it is about, you can see here, a little extra vegetables, not much change from that, a few extra ounces of grains, a half an ounce more in protein. It's not a half a serving, it's a half an ounce. Okay, so it's really important to note that the diet should be balanced. It should be providing those nutrients, but it's not double the intake. And this is great. I love this. So this would be for the second and third trimester, perhaps, okay, and breastfeeding. And it shows you amounts here. So look at these foods and look at the serving sizes. And what you should see is it's a really healthy diet, but it's not a huge portion diet. That's just a cup of cereal with milk and orange juice, okay? That's a little snack of peanut butter and celery and some toast and yogurt. So that might be those extra 450 calories. Lunch is a salad, okay? And it looks like cheese toast or a cheese sandwich. Dinner, a snack again is whole wheat crackers and juice. Dinner, 2 burritos, some vegetables, and snack granola bar and a banana. Okay, so there's all of these foods are very nutrient dense, not what we typically kind of imagine that pregnant women are eating, you know, big servings and sundaes and cookies. That's not a healthy diet for pregnant women. So pregnant vegetarians need to be careful about the nutrients that could be in short supply. Prenatal supplements are probably a good addition for them because of that reason. Okay, some problems that occur during pregnancy. And typically these are due to hormonal changes that relax some muscles, as well as the crowding of your digestive organs and others as the fetus grows. So you see here, heartburn is very common, and the recommendations are quite similar as they are for anyone with heartburn. Constipation, the same, lots of fluid and exercise. Make sure that you get enough fiber for sure in the diet. And edema is not uncommon, okay, because of placental hormones causing tissues to retain fluid, more blood overall, okay. And for mild edema, you really don't need a salt restriction. What you have to watch out for is whole body or full body edema with an increase in blood pressure and also protein in the urine, because this could be the sign of a more dangerous condition, toxemia preeclampsia. Okay, nausea and vomiting is very common early in a pregnancy. The remedies that have been used for generations are, you know, just keep yourself away from nauseating smells, eat something dry, like a cracker or an unsalted pretzel, eat frequent meals. More recently, we know that vitamin B6 might have an effect at tamping down this nausea. But be careful, because vitamin B6 was the vitamin, when we take too much of it, it can cause nerve damage. So that irreversible kind of numbness of the fingers and toes. Ginger is one that looks or is promising as well. Either a ginger tea or some just ginger to chew on may help with nausea. So anemia is another common kind of physiological response. We need to make sure that the pregnant client has enough iron in the diet and that is eating a diet where the iron is bioavailable. Okay, so I want to touch upon another not uncommon condition, 10% of pregnancies, called gestational diabetes. And for this, I'm going to show a short video that I really, really like and then follow up with a few comments.
I'm Dr. Monique Hederson. I'm a research scientist at Kaiser Permanente's Division of Research, and our study just found that women who gain excessive weight during pregnancy, especially during the first trimester of pregnancy, are more likely to develop gestational diabetes later on in their pregnancy. We found the association was even stronger among women who are overweight or obese at the start of their pregnancy. I'm a new mom and I know how hard it is to not gain too much weight during pregnancy. I just had a baby myself 5 weeks ago. But now we have more evidence than ever that suggests that it is so important to not gain too much weight during pregnancy, both for your baby as well as for your own health. Gestational diabetes is a glucose intolerance that develops during pregnancy. It's usually diagnosed between the second and third trimester of pregnancy. And it's a concern because gestational diabetes has implications for both the infant as well as the mother, and both long-term and short-term consequences. When you gain too much weight during early pregnancy, it puts extra stress on your pancreatic beta cells. And those pancreatic beta cells release insulin, and that is responsible for regulating your blood glucose level. Then during pregnancy, we know that as pregnancy progresses, all women develop increased insulin resistance. And if you've already exhausted your pancreatic beta cells, they are unable to compensate for the increased insulin resistance that occurs during late pregnancy. Our study followed 1,145 women over the course of 3 years. These are women from an ethnically diverse population. And we found that women who gained more weight than is recommended by the Institute of Medicine guidelines had a 50% increased risk of developing gestational diabetes during their pregnancy compared to women who gained within or below the Institute of Medicine guidelines. The IOM guidelines are based on what your weight is at the start of your pregnancy. So women who are overweight or obese at the start of their pregnancy are recommended to gain less weight than a woman who is normal weight or underweight at the start of her pregnancy.
Okay, let me get us back where we were. Okay, so it is important to kind of keep track, to make sure that you are not going overboard with the calories, with the treats. We all deserve treats, but that it doesn't become too many calories for sure, because that can lead to poor health of both mother and infant. Okay, hypertension, we follow very closely. And what, again, we're worried about are preeclampsia leading to eclampsia, which can be a very serious condition. This may be related to some of the micronutrients. You see here, adequate intake of calcium and vitamin D seems to reduce the incidences. Okay. All right, on to the last section of this, which is on breastfeeding. So we're going to take a quick look at breastfeeding and the recommendations around that. So the recommendations are generally exclusive. That means only breast milk for the first 6 months of life, and then a combination of breast milk and infant foods until a year. Okay, and you see that there. The World Health Organization says breastfeed for at least 2 years, and we're falling short mostly in the duration of breastfeeding. Okay, you can see that there, it drops off. We have a good number of mothers who attempt breastfeeding, but we see that only 25% exclusively breastfeed at 6 months or up to 6 months. So that is a little bit of a concern. Okay, so how do we help change these statistics a bit, but also taking in concern, putting the mother certainly at the center of this? That would be the job of a lactation consultant, and that is something I wanted to introduce you to. There are many reasons why mothers stop breastfeeding, and some of them have a workaround. Okay, so there are times when breastfeeding just doesn't work for women for any number of reasons, and that mothers should be supported in that decision. But sometimes there's a workaround. There's something that can be changed as far as how you feed the baby, how you hold the baby, your diet, your relaxation, et cetera, et cetera, et cetera. So let's see if this link is working. This is Drexel University's Human Lactation Consultant Program. It's a very nice certificate program. And what is interesting about this program is that you have taken, if you're preparing for nursing, the prereqs that are required. So it's a very nice mesh with the healthcare studies program. What's also really interesting about this program is that, okay, and let me make sure I am back, and I went back to the wrong place. So here we are. What is also very interesting about this program is that it has a decent salary, even without a nursing or nutrition degree. So you can get a good job after completing the certificate. So that's great, a great option. All right, so read through milk production. It's really fascinating, to be honest. Not only the production and the process by which that milk is released, but also the impact, the effect of hormones in this process, and also the change in the milk composition during the feeding. Okay, so here are some important facts here, how you know if the infant is being well nourished while being breastfed. We follow weight quite a lot, but we also look at stools, how many, wet diapers, how many. It might take a couple of weeks to establish a routine, and it's easy just to throw your arms up and to think, I can't do this. So that's why the lactation consultant is so very important. Okay, and they recommend holding off on a supplemental bottle or breast milk in a bottle until breastfeeding is well established. So there are qualities to breast milk that are superior to formula. Okay, now formula is fine, but breast milk actually changes composition during the feeding, and you'll read about that, to become higher in fat and then lead to satiety later in the feeding. Note that we should not be using cow's milk until 12 months of old, 12 months of age for the infant. It's too much stress on the kidneys, and it can also cause some bleeding of the GI tract. So that's important. Know what colostrum is. That is what sometimes is called first milk. It is the thick yellow milk that is produced late in pregnancy and for a few days after birth. It's very rich in factors that are important for that infant's immune system. Okay. Mature milk looks quite different, doesn't it? It's kind of slightly bluish and thin. Should babies get additional water? Not unless your doctor, pediatrician says so, because too much water can crowd out nutrients, can cause low blood sodium, and both milk and formula should have enough water as they're in their composition. Okay, so double check on that. The American Academy of Pediatrics advises against supplemental water or juice during the first 6 months. Babies who are preterm can be fed breast milk, okay, and it's actually has been shown to have some positive effects, as you might imagine, okay. And what about the diet of women who are breastfeeding? Okay, so the diet is slightly higher in calories, a couple of hundred extra calories compared to pre-pregnancy, not compared to pregnancy. Should be a nice balanced diet with plenty of fluid. So they recommend an extra 330 to 400 calories compared to pre-pregnancy. So that's somewhere around or a little less than the pregnant calorie needs. This covers the milk production and allows the mother to draw down from her fat stores. Now, since some of these micronutrients are still high, the need is still high, many pregnant women continue their prenatal supplements while they're breastfeeding, many breastfeeding women. Okay, so what are the advantages? Why bother? There's so many. Fewer infections, lower risk of obesity-related diseases, convenience, cost, and here's another list: better jaw development, fewer ear infections, provides antibodies, decreased risk of childhood cancers like leukemia and lymphoma. Do read on this, because I think we need to make sure that we share all of these benefits, advantages of breastfeeding with the individuals who are making that decision, okay? And there are also advantages for the mother who breastfeeds, and you see that here. Things like high blood pressure, cardiovascular disease, diabetes, risk is decreased. Ovarian and premenopausal breast cancer risk is decreased. Weight loss back to pre-pregnancy weight is quicker, okay? And the uterus going back to its pre-pregnancy state is quicker as well. So breast milk and breastfeeding can be combined with work, can be combined with bottle feeding by the manual expression or breast pump expression of breast milk. You can store it in the refrigerator, you can freeze it as well, okay? And what are the barriers? Why do we have these numbers that are lower than we want? Some of it's misinformation. A lot of individuals have heard about this horrible pain that occurs with breastfeeding. In the beginning, when you begin, there may be an intense kind of feeling you might describe as pain with the letdown reflex, but that typically becomes less over time. If there's pain for longer, it might have to do with the feeding technique, the way the baby's being held, the way the baby's latching on. And this is where a lactation consultant becomes so important. You can see here, we in this country still have some social concerns around breastfeeding, which is, kind of outdated. We certainly should embrace mothers who breastfeed because it is so good for their children. And there are some medical conditions, mothers with TB, HIV positive, those undergoing chemotherapy, we would tell them they should not breastfeed, okay? Yes, environmental contaminants can pass into breast milk, so you have to be careful about your diet when you're a breastfeeding mom. And as far as supplements for breastfed infants, infants exclusively breastfed should be given vitamin D, and this is to prevent rickets. And iron supplements are begun at 4 months of age. No fluoride is necessary before 6 months. For breastfed infants of vegan mothers, they need B12 supplements. Okay, so birth defects are covered in this chapter as well. Sometimes we don't know the cause. Sometimes we know that the environment comes into play with these birth defects. Folic acid is a nutrient that can decrease the risk of neural tube defects by 70% if you get enough folic acid in early pregnancy. So that periconceptional period is very important. This is why we recommend that all women of childbearing age should get enough folic acid, right? And iodine deficiency has consequences as well. Vitamin A toxicity can cause fetal abnormalities, so facial and cardiac effects. So you have to be very careful with vitamin A supplements. You see here, there's a limit, but I would say don't take vitamin A supplements, just what is in that prenatal supplement. Caffeine, there is some research that shows there are problems with heavy caffeine intake during pregnancy. It may reduce blood flow through the placenta. It may cause some withdrawal symptoms in newborns and even increase the risk of miscarriage. So moderate caffeine intake has not been shown to be unsafe. Okay, we recommend, of course, against phenylalanine as part of equal aspartame for women who have PKU, because this disrupts fetal brain development. And, as far as obesity and other health conditions, certainly it's all about regular checkups. It's about management of blood sugar, management of blood pressure, just making sure that you're checking in with the doctor. Okay, and we have not talked about fetal alcohol spectrum disorders. There's a spectrum now. We used to only talk about fetal alcohol in its extreme, okay, the fetal alcohol syndrome. But now what we see are lesser amounts of alcohol during pregnancy might not cause this fetal alcohol syndrome, but could cause hyperactivity, short attention span, limited hand-eye, some learning disabilities, etc. Okay, take care.